Hi, my name's Jim Meadows. I'm a physical therapist trained in the United Kingdom and practice in the United Kingdom and Norway and Canada. Um, Primarily, I'm a teacher of manual therapy, and I think that this is my last year of teaching. So I would like to give something back to the profession that's been so good to me. And that something is a free online course in manual therapy. I'm thinking this should be a year long, maybe a little longer, depending on how we progress, but probably a year. It will be online, entirely online, and it will cover concepts and processes and principles of manual therapy. There will be technique videos, but of course we can't do a live class. Um, Although I might try to figure out something about that as we go through this, at least to do some demonstrations for you. But primarily, it's about understanding concepts. This course isn't about giving you techniques or tips on how to do things. It's about trying to get you fully um, involved in understanding what we're doing, not just doing it. So, this really is for people who are lifelong learners who want to do more than um, the essentials, the bare essentials for everyday practice. I would look at this as a step towards you developing expertise. I can't teach expertise. I'm not even sure I have expertise. I'm not even sure really what expertise is. But I think we've all got a picture of it. It's like, oh, you may not know what's good are, but you know what you like. Same thing here. Um, if you understand the processes and the concepts, then you can develop amazingly high levels of professionalism and therapeutic expertise as you go. So that's what I'm hoping this course will do. It is free. I will offer exams both during the course for your benefit, really, not for mine at all, but so you can get an idea of how you're progressing, where your weak points are, and what you need from me. And then we can look at some final exams for those who want to do it. These are not compulsory by any means. They're available. So if you want to do it and you pass them, I'll give you a certificate of competency. If you don't want to do them, I'll give you a certificate of attendance on the course. But I'm pretty sure that in any case, you will benefit from this course. The course will cover these categories, pretty much the entire domain of manual therapy. Um, we'll look at practical clinical reasoning, not the theoretical stuff, but how to use clinical reasoning. This will include making the diagnosis and correcting for bias and error, which is going to happen to you. Even with simple diagnosis, you're going to make mistakes. Um, it will be about diagnosing, making a precise diagnosis, as precise as you can do in the clinic at least, determining whether or not this needs to be referred out or whether you can carry on treating it. And if it is going to be referred out, is it an urgent referral, non urgent, or semi urgent? We'll look at those aspects of safety. Making a prognosis, we'll be looking at why you make it. And the main reason you make it is so that as you're treating the patient, if the results are not matching your prognosis, there's been an error. Um, and this will cause you to go back and look to see if you can correct that error or not. We'll look at etiology searches. This is the most interesting part of manual therapy, as far as I'm concerned, is actually looking for the base cause of this. Overuse syndrome is overused. Because somebody's playing tennis and they've got a tennis elbow, it doesn't mean to say playing tennis causes a tennis elbow. We'll look for neurophysiological, neurological, and mechanical reasons why these common injuries that we see are occurring, and hopefully do something to reduce the occurrence rate. And then we'll look at treatment plan and execution and the progression of those treatments. So there's pretty much everything in here, but it's going to be about why you do this, why it will make you understand not only why you do it, but how you do it. And it will allow you to innovate and use your own techniques, your own thought processes, your own manual processes on how you do this. The course should last about a year, and that depends on how we both do. I've never done this before, and nor, I believe, have you. So we'll see how we progress. There's no strict time limit on this for me, but I would expect it to run somewhere between 12 and 15 months, maybe. There'll be a video distribution. One, two, or three videos totaling about an hour a week. What you need to do is not just watch these like a video, but study them like a lecture. It's a recorded lecture as much as anything else. So take notes and be critical of what I'm saying. Just don't accept it. Be critical about it. After that, we'll have a weekly Zoom session, which will be on Sundays, Sunday morning for me. And I don't know what it will be for you, but it will be around about 10 in the morning for me, which is Central Standard Time at the moment in the US and Canada. Actually, it stays the same because I'm in Mexico actually now, so they don't change the time zone anymore. So there'll be the Zoom session there is to basically review the videos based on your questions, which I expect you to either ask at the time of the Zoom session or send me emails about if you have questions, and I'll answer them. And any other topics is worth mentioning around the videos or completely unconnected with the videos. This is your course. You get to ask what you want when you want to, and don't be frightened of that at all. I will record the Zoom session, so if you can't make a particular Zoom session, then you'll at least have the recording and you can watch it in your own time. Your minimum content commitment to this will be the 2 hours of video and Zoom sessions. I will give you some readings and directed study to do as well, but they're your two main commitments, and I would like you to attend as many of the Zoom sessions as you possibly can, and also watch all of the videos with a view to study in mind. Remember, you volunteered for this course, and this is your benefit that you do this. It's to my benefit not to feel like I'm wasting my time. So it would be nice if we were both happy at the end of all this. Be critical, though. All right, think critically and be critical of me as well. If you don't like the responses I'm giving you don't like what's in the video, say so. I won't take offense. It's what my job is. So by all means, question me. I don't mind that in the least. It's dead silence that kills me. I'll offer tests, as I said earlier. We'll do periodic tests through the course just for your benefit, so you can take them, see what your results are like, and I'll look at the general results, but I'm really not interested in looking at your individual results. These will be for you and only for you, and you can learn from them. If you want to ask questions about those tests, we can do that as well. I'm also prepared to do extra Zoom sessions for people who need it, want it, or want to talk about things other than the curriculum. So again, the results of your online tests we can do as well. The final exam is like the periodic test, optional. You can do it or not do it. If you choose to do it, there's no fee for it. If you need to do it again, you can do it again. Again, no fee. I don't mind. You can do this as much as you want to. And if you pass the exam, complete the course, I'll give you a certificate of competency. And if you simply complete the course, not do the exam, I'll give you a certificate of attendance at the end of all this. Okay, it pretty much sums up what the course will be about. And I'm going to put my email address up again for you. And please contact me if you've got any questions. To register, same email address. And then we'll go from there. All right, guys. Thank you for listening to this. And I hope to see you all, or at least most of you, on the Zoom sessions. Take care all. Bye.